Okay. So first thing you do, you're gonna come into the room. Hey, how you doing? I'm Mason Mark. I'm IDC school student. I'm going to perform the chest exam today. So first thing we're going to do is we're going to get into the set of vitals on you, all right? Okay, here we go. Go ahead and get your vitals. Okay, that includes blood pressure, pulse, temperature, and SpO2. Okay. So when you're collecting the pulse, you go ahead and grab the patient's wrist here. And what you're going to do is obviously find the radial, and you're also going to be observing the chest wall movement. Okay. So while you're doing this, after you actually collect your pulse rate, you can go ahead and continue to hold on to the radial pulse and actually observe the rate and pattern of the respirations. Okay, without letting the patient know that you're actually observing those things. After that, what you're going to do is you're going to ask the patient a couple questions. Do you have any allergies?
I do.
Okay. What kind of allergies do you have? Okay, you're allergic. What kind of reaction do you have to penicillin? Okay, so anaphylactic reaction? Okay, great. Are you taking any medications right now? Okay. Oh, yeah. Yeah, okay. So you're not taking any medications currently. Do you use alcohol? Okay, and do you use tobacco products? Okay, great. So that covers the first part of the whole PCL. Second part you're going to roll into after that is you're going to go into inspecting the chest. So at this point, you ask the patient to remove their shirt. We're not going to get into that. But first thing you're going to do is you're going to note anatomical landmarks, okay? So starting with the sternal notch, I always work my way down the chest and then onto the back. Sternal notch, right below that is the angle of Louis, which is also the manubrial sternal joint junction. Below that is the sternum, then the xiphoid process, okay? So that's this whole area right here. You can also note the position of the clavicle, and then as you're down here, you can note the costal angle. It should be 90 degrees, but in certain individuals like pregnant females or older people, it can be turned into barrel-chested, and your angle is going to be greater than 90 degrees, and the ribs are actually going to be straighter. While you're here, you can also note the transverse diameter of the chest versus the posterior diameter of the chest. Okay, a 1-to-1 ratio would indicate barrel-chestedness. Right. On top of that, you're also going to be noting the C7 and C1 prominence, which is on the back here. Okay, it's the start of the thoracic cavity in the vertebral line. So on top of that, you're also going to note all of your anatomical lines. So you're going to note your sternal line, your midclavicular line, your anterior axillary line, which starts at the anterior skin fold, your mid-axillary line, right in the armpit here, your posterior axillary line, back here, and that's going to be at the posterior skin fold, and then your right in the middle of the scapula, the mid-scapular line, and then the vertebral line. Okay. So like I said earlier, you have your posterior axillary line, your mid-axillary line, and your anterior axillary line, following those skin folds, both anterior and posterior. Okay. So after that, I'm inspecting the actual thoracic cavity. I'm looking for the movement of the chest, the thoracic expansion of the chest, okay, and what you're looking for is symmetry. Symmetry is one big thing. Now you can also observe some abnormalities of thoracic expansion. So if the patient is potentially breathing with the diaphragmatic type breathing or paradoxical breathing, chest going in, abdomen coming out, paradoxical breathing. On inspiration, the chest goes in versus the thoracic cavity expanding, okay? That's paradoxical. So the other thing that you can also note at this point is if they're using normal thoracic muscles for their breathing, which is a normal type thoracic symmetrical breathing. So while I'm here, I can also note any peripheral signs of respiratory distress, starting with the most severe would be cyanotic. So if the patient is cyanotic, that's something you're going to be able to tell right from the get-go. Next, you're going to also be looking for nasal flares. You're looking for pursed lips. You're going to be looking for the use of auxiliary or accessory muscles. Thank you. And then you can also do. Can you go ahead and go like this for me? And this is clubbing. Okay. So you're looking to see if the nail beds touch. An abnormal result would be if there's a 90-degree angle like this. Okay. So that's called clubbing. All right. So if it's abnormal, it's going to be more than 90, or it's going to be 90 degrees. And what that is an indication of is either cardiopulmonary disease, long-term cardiopulmonary disease. Okay, so that's just another indication. So the other thing you can look for, especially in the neck area, is called retraction. So it would be if the muscles and the skin of the chest on inspiration actually retracts into the thoracic cavity. That's another sign of respiratory distress. All right. So from there, after I've noted all this on the inspection, I actually haven't laid hands on the patient at this point. So what I'm going to do now is I'm going to start palpating. So when you palpate, the easiest way to do it is from top to bottom. Okay, so when I first start palpating, I'm going to isolate the trachea, and I'm going to be noting things about the trachea. So the easiest way to isolate the trachea is to go ahead and grab right where the clavicular lines are here, and I'm going to put my hand or my thumbs into the sternal notch. I'm going to then gently slide them up, and I'm going to kind of retract a little bit of the skin here, and I'm looking for if the trachea is midline. Now I'm going to go ahead and take a deep breath for me. Okay, good. And what it should do is the trachea should stay midline. It shouldn't tug one way or the other. Okay, so looking for tracheal tugging and midline of the trachea. The next thing I'm going to do is I'm going to palpate. So I'm going to go from above the clavicle, which is where the thoracic cavity starts. I'm going to work my way down. And I'm taking note of different things. I'm taking note of if there's any pain, any facial grimace from the patient. I'm also going to be taking note of if there's any depressions, pulsations, or crepitus, either bony or subcutaneous. And that starts up here in the tracheal area. So what that could indicate is air escaping from the pleural sac or the pleural or the thoracic cavity. So I'm looking down here. Okay, I don't feel anything. Go ahead and take a breath for me. Okay, and then I'm going to gently squeeze, and that's going to give you an indication of any tenderness palpation, especially in the thoracic area. While I'm down here, I'm also going to note thoracic expansion. So go ahead and take another deep breath for me. Yeah. Go ahead and take a deep breath for me. And you should have that symmetrical, normal expansion, equal on both sides, and your thumbs should come apart and come back together. Okay? So I'm going to do the same thing on the back. I'm still palpating for the same things: depressions, crepitus, pulsations, and pain. All right. So I'm working my way down from the scapula all the way down, coming down, and I can say, go ahead and take a deep breath for me. Okay, push together, looking for any signs of pain, any signs of facial grimace, and then you're going to do the same thing with thoracic expansion on the back. So go ahead and take a deep breath for me. And the thumbs should come apart equally and come back together equally. Okay, can you turn around for me? So the next part of palpation is the patient actually has to be enthralled. So you have to ask them, okay, so what I'm going to do next is I'm going to check for what's called tactile tremendous. Okay, so what that is I'm going to place the ulnar surface, or you can do the palmar surface, but the ulnar is more sensitive. Ulnar surface of my hand on the thoracic cavity, starting high and working my way down, kind of like that, okay? And what I'm going to say is I'm going to say, can you, whenever I touch my hands to you, can you just say 99? Okay. 99, 99, 99, 99. Okay, and what you're looking for is vibrations, all right? So the vibrations should be equal on both sides. So if there's extra vibration on one side, that could be an indication of consolidation, or excessive vibration on one side could be the indication of consolidation. So I'm going to do the same thing on the back, all right? Go ahead and say 99. 99. 99. Okay. 99. 99. 99. Okay, thank you.